the Director General, Dr. Buthelezi, senior officials from the Department of Health and members of the Advisory Committee on COVID-19 vaccines, and members of the vaccine task team, and members of the media, fellow South Africans. Thank you for the opportunity to present briefly the Department of Health Vaccine Rollout Strategy. We have always said that the second wave is going to be coming, and that the only way we will be protected is by developing herd immunity through vaccination. We have now over 1 million people who have tested positive, and we have seen that the numbers have gone as far up as just close to 18,000 of positive cases per day. We have also seen that our fatality rate has gone up to 29,000 people. And therefore, it is clear that the second wave that we are going through is affecting us to levels which are even higher than what we had seen in the earlier surge. And the only way of being able to deal with the COVID-19 pandemic, not only in South Africa, but throughout the world, is the provision of the immunity through the vaccination. Because we've been working very hard by following all the research and development that has taken place globally, we have been trying to follow what is the best way to deal with this. And there's been a lot of work that's been done at this level. And therefore, at this point, we do believe that the issue of rolling out vaccines has to be handled with the agency, and that it has driven us to expedite the availability of the vaccine, because this agency is the only way that everyone else in the world has actually embraced the approach to deal with this problem.
Minister,
we believe that...
I'm very sorry, Minister. Because we are broadcasting live, may I please request Minister to switch on the video? I'm very, very sorry to interrupt you, Minister.
Okay, I think the host should assist us with that, because it's just check if the host is able to do that.
Okay, Minister, we have made Minister a co-host.
There you are.
Thank you very much, Minister. Apologies.
Thank you.
Please
thank you very much. Sure. Well, thank you very much. Therefore, let me then say that we believe that the vaccines have to be made available to all South Africans, starting with the frontline care workers and the most vulnerable, to ensure that there's protection for them first, as amongst the most vulnerable groups. Our health workers are the core soldiers in the fight against COVID-19, and they need to be protected so that they can ensure the stability of our own health systems. Now, these vaccines need to be available, I would say, for the majority of the people. We need to be able to get them rolled out to them by the end of 2021. We've taken much of the advice from our Ministerial Advisory Committee on Vaccine, which we shall introduce shortly. We did introduce to the country in September, but I think just because we're busy with this discussion now, it's going to be important to just reintroduce them. We will ask Professor Perry Shoop, who is an experienced professor who has dealt with the issues of immunology and vaccines for over 30 years of his career, and a whole lot of other members who are just as experienced. The Ministerial Advisory Committee on Vaccine has been working quite hard since it was formed, working together with government to advise in terms of the developments worldwide, and also looking at the suitable candidates of our vaccines so that the country can work on the basis of very good advice. Therefore, I'd like to thank them at this point for their hard work and selfless service to the country, and for their expertise and their dedication. And all of them would know that we have engaged in several meetings, and sometimes calling some of them during very difficult times at night, to be able to make sure that we've got the right advice as we move along. I would like to also indicate that the advisories from this Ministerial Advisory Committee will be uploaded by the end of this press briefing. Based on these advisories and input from various stakeholders, including other government departments, we have set up structures, excuse me. We have set up structures to expedite the financing, the sourcing, the procurement, and therefore the issues of the vaccine strategy will get undivided attention from the whole of government. We want to therefore assure the public that we are very mindful of the agency, particularly as we feel the impact of the second wave we are currently experiencing now. So everywhere you go, everyone can feel the pressure, and I think all of us have a sense of personal anxiety, where we now wish to know at which point can we say we are, safe from this kind of a pandemic. The purpose of this media briefing is to also just indicate the kind of work that's been done to expedite the availability of vaccines to all South Africans. I'll touch on some of the key issues, and then Professor Perishu will also come in, and then Dr. Anban Pillay will also, from the Department of Health, will also expand on some of the areas. In other words, the approach, the strategy, the Ministerial Advisory Committee will give outline on that, and then on some of the practical implementation of the distribution and delivery, distribution infrastructure and delivery mechanism, Dr. Anban Pillay will touch on those issues. But we always say this is work in progress, which means therefore that there's a lot of input that continues to go into this process. At this point, we are targeting the minimum of 67% of the population to achieve herd immunity, and the approach will be a phased rollout of the vaccine, beginning with the most vulnerable in our communities. And therefore, we would say, for example, broadly, the first phase has to deal with the issues of frontline workers, and I'm sure the team will indicate there's probably over a 1.25 million population. Phase 2 will then focus on essential workers and persons in congregate settings. It will deal with the people who are elderly and also those with comorbidities. And all of that together will be also complemented with later the introduction to another 22 million people. So all in all, this will be about another, say, the phase 2 will be about another 16 million people. So all in all, therefore, we would be targeting about 40,350,000 citizens. If you just calculate at that level of 67%, who must be immunized, and that's equivalent to 67.25% of population, as we've indicated. At this stage, we have secured the doses that will be acquired through the COVAX, which will ensure that we immunize 10% of the population. This mechanism, you would have heard that the president spoke about this, that we expect this process that it will have delivered the vaccine by the beginning of the second quarter. This is what the COVAX arrangement is able to deliver to us. Then, of course, we have to raise the funds to pay for the outstanding amount, which would be the additional over almost 50% of the population in terms of that calculation. You recall that already the 1.8 billion rand we had already earmarked on the budget, as well as the deposit that was put up by Solidarity Fund. Now that work has been done. We have noted that there were people who were a bit skeptical about the fulfillment of the government's commitment. Excuse me. But we must say that we have cleared all those technical hitches, and the point we're dealing with now is that we are waiting for the COVAX to deliver. So we then need to deal with the 57% of the population, which we are targeting. which is important for us, that we are doing everything we can to get to those manufacturers that can deliver to us earlier than the date that the president had set. Although that date, we know that by that point, we would have already been, we would have received the COVAX facility, but we are trying to get as much as possible some vaccines to be available much before that date. In fact, we are targeting February, although all of that is going to depend very much on the success of the current bilateral negotiations that we're having with various companies. So it is really more our wish, and we will not at this point say there's any company that's confirmed that date. We're just fighting to make sure we can get something earlier than that date. But the COVAX facilities, for sure, by the time that we're talking about the beginning of the second quarter. Therefore, to raise these funds, we've embarked on an additional public-private partnership, which is already at this point giving us very good outcomes. We've already approached medical aids to finance, to co-finance with government. We've also now been discussing with the Council for Medical Schemes, and we've ensured that the issues that relate to vaccines and other related therapeutic agents are available as what we call the prescribed minimum benefits, so that all the medical schemes are able to cover that. In the past 2 weeks, we have negotiated this matter, and in this process, we have also signed the amendment of the regulations to ensure that this is possible throughout all the medical schemes. I have a team which I will introduce just at the end of this, which is a task team which has been assigned to work with us, reporting directly to the minister on the negotiation with the medical schemes in the whole country. And in addition, we're also approaching the private sector, so that there are 3 mechanisms of raising the funds to augment the resources needed for the rest of the 67%. Is government financing, is medical aids, is also the private sector contribution. Business has also been engaged through some of the organizations, Business Unity South Africa and other organizations, and therefore this engagement means that we will have to work out an arrangement. Particularly, we've approached the Solidarity Fund to assist us with the platform that will ensure that we can have a facility to collect the funds, and also to assist in the procurement process, because some of the procurement issues with Treasury will require that we need an expedited process that will be able to help us in this process, in the procurement of all the additional vaccines that we're looking for. To optimize the availability of stock, we have then started the bilateral negotiations with various manufacturers, pursuing those that were indicating appetite to make vaccines available sooner. We're at a very sensitive stage with our discussions. We have signed a non-disclosure agreement with various of these manufacturers. We also have signed, we have also received the terms of agreement from various of these particular manufacturers, and we are waiting for specific offers that need to be discussed between us and those companies. And in a number of them, I've been personally involved in the discussions. I can mention a number of them. For example, in the discussions in relation to Fisa, to Moderna, to AstraZeneca and some of the licensees, as well as J&J and so on, we've been involved. And in fact, I've also been involved in some of the representatives from the Russian vaccine and some from the Chinese. So the team will talk a little bit about those, because we're actually engaging literally everyone in here. And so we are also working very closely with the SAPRA, our regulatory authority, so that we can ensure early clearance of those vaccines that have got proven capabilities. And in this case, SAPRA, excuse me, SAPRA has already created a fast-track mechanism which is very technically sound and professional, which will make sure that there's urgent attention given to those who are applying. They've actually got a mechanism that allows every of the applicants to submit information as and when it becomes available, so that at the end of the process, there's no need to go back to the beginning. A lot of work would have been done to fast-track that process. And we have done this to make sure that when we find something, a vaccine that is available, we will then not be delayed by regulatory processes. The department has already started to embark on the creation of distribution and delivery structures, and that those will involve the national government, the provincial government, the district at the district level, public sector and government, and the private sector. Private sector and public sector will be working together. We'll also ensure the involvement of the civil society, traditional leaders, and other structures at the different levels of government. This will ensure that we can take our community along, because there's a lot of communication that has to be done, and there's a lot of championing that's important here. In the first instance, our communities need to be made aware of the available vaccines at this point, and also the value of the vaccines, and how and when and which categories are at which point receiving the vaccines. And at the same time, we also need to deal with some of the misconceptions that we are picking up in the social media about hesitancy, vaccine hesitancy, and so on. So as I've said, that I have personally participated in discussing with the leadership, the global leadership of the various manufacturers. We've done that in two of the capacities in which we serve. On the one aspect, on behalf of South Africa, we have been involved in a lot of discussions. Literally every second, third day, we are actually involved with some of the discussions. And at the same time, I'm also part of a task team that's been created by President Cyril Ramaphosa, which is the African Vaccine Access Task Team, which is led by Mr. Siwiya and and a number of other participants that would include the president of the Africa Exim Bank, as well as the Commissioner for Social Affairs in Africa, and the CEO of Africa CDC. So in these discussions, we've been able to gain access to a lot of information, for example, that suggests that most of the countries that have started vaccination, because of the vastness of their resources, they've been able to bid for all the vaccines much earlier, long before even the vaccine outcomes trials were released. So they actually put up lots of resources at that level. Unfortunately, we have to work together in a situation where we've got a much more constrained environment. But at this point, we're quite comfortable that at the time of the rollout, we would have been able to catch up with most of those countries that are doing, at this point, that have already started some of the vaccination. A lot of work has been done also behind the scenes by the president to reach out to a number of these constituencies, because a lot of debate about repositioning our continent and South Africa is actually taking place there. And of course, there is an understanding that there is a particular responsibility that the manufacturers have to take into account as they look at the situation of the African continent, which we're part of. On the other hand, of course, we are participating in what is called the ACT Accelerator, which is the access to COVID tools, which are looking at a lot of innovation in terms of the new innovations in relation to therapeutics, diagnostics, as well as vaccine access. And we, South Africa, are co-chairing that with Norway, working together with WHO. So we receive a lot of guidance also from the WHO in terms of which way we need to be moving with regard to the issue of the vaccination. So we would be in a position to find adequate information to utilize to ensure that South Africa does not get left behind, but also are working on behalf of the entire continent, as President Ramaphosa is the president of, is the chairman of the AU. So that work is being done. So a little bit more of details will come from the team so that you can get a sense of or a flavor of the stuff that is taking place behind the scenes. And once they've done all of this presentation, I'll also bring in, just to introduce the members of the task team that is working with the business to facilitate additional funding in a partnership between public and private to ensure that the 67% of vaccines or of population, we can get vaccines for that whole population at 67%. So with that, I'd like to invite Professor Perry Schupp, who is the chairperson of the Ministerial Advisory Committee, and I'd like Professor to take us through, introduce the team and give us an outline of the strategy. And after that, we'll invite Dr. Anban Pillay to take us through as well. Professor Perry Schupp, if you could just proceed. Thank you very much.
Thank you very much, Honourable Minister of Health, Honourable Deputy Minister of Health, the Director General, colleagues, members of the media, ladies and gentlemen. Thank you very much for inviting me. I'm going to give a very brief overview of the activities of the Ministerial Advisory Committee on COVID vaccines. I need to share the screen. Right. Now, vaccines have always really been a major tool in the fight against infectious diseases. We know this from many, many infectious diseases, and particularly viral diseases. So clearly, vaccines would play a very major role in controlling the COVID epidemic. And it's not surprising that there's been a frenetic development of vaccines at breakneck speed. So today, in fact, up to date, there's really been 289 COVID vaccines, which are currently in development. Most of them, of course, in the laboratory phase or in the experimental animal phase. But over 66 have been in clinical trials, and of these, three have emerged in the phase 3 trials. Quite a number have emerged to be shown to be safe and to be effective, and 4, apparently, are currently licensed. So this data collected from these clinical trials, which are, of course, extensive trials, in the case of the COVID vaccines, really compressed into less than a year in the case of those vaccines which have been licensed, and they've been shown to be safe and effective. So this is really where the Ministerial Advisory Committee on COVID vaccines has come about, to develop a strategy to ensure equitable access to vaccines, to look at the various aspects of vaccines, and to advise the Minister accordingly. Amongst the things are the tasks that the Advisory Committee has been tasked with are the various purchasing mechanisms, the funding implications, looking at local manufacture or distribution into the vials, into syringes, and particularly important, identifying priority groups for vaccination. So this is really the objectives of the MAC. The primary objective really is to provide the Minister of Health with advice, with the best advice that we as experts, and I'll come just now to the membership, because it does span a range of expertise, can provide to the Minister, basing it on current scientific evidence and best practices, choosing the appropriate vaccine option appropriate to our local conditions and based on sound scientifically based, evidence-based reviews published in the literature, and also what we get told from meetings with the vaccine manufacturers. Looking at the vaccine purchasing options, the Minister has spoken about the COVAX facility. I think the details of that are very well known. Looking at the budget implications of vaccine options, extensively looking at priority groups, and I'll come to that just now, The vaccine rollout strategy, Dr. Pillay will deal with. And then looking also at the possibility of local manufacture and also local distribution and filling of vaccines. So this is our vaccine Ministerial Advisory Committee committee. I myself am the chairman of this. My background is in both virology and vaccinology. I was formerly the director of the National Institute for Communicable Disease, NICD, and I'm Professor Emeritus of Virology at University of Witwatersrand. Then Dr. Untitled Chapter, who you'll be meeting just now, the Deputy Director General in the Department of Health, Dr. Morena Mokoena, who's the CEO of BioVac, which is a local facility for manufacturing and distributing of vaccines, Glaudina Lewitz, who's from the Department of Science and Innovation, Dr. Tumi Tsimeta, who's the CEO of SAPRA, the South African Health Products Regulatory Authority, which licenses vaccines. Professor Greg Hussey is a former Dean at UCT Health Sciences and is now the Director of Vaccines for Africa, VACFA. Professor Jeffrey Mpashlela has a number of hats, Medical Research Council. He's a Deputy President. He's a virologist and an immunologist, and he's on the SAPRA board. Professor Helen Rees occupies many chairs, both locally and internationally. She's the chair of SAPRA board and also internationally an expert advisor to WHO, to Gavi, which is a Global Alliance for Vaccine Initiative, CEPI, which is a Coalition for Epidemic Preparedness, the WHO Regional Technical Advisory Group, National Advisory Group Immunization, and so on. Professor Ames Dyer is the director of the Steve Biko Institute of Ethics at Wits University, is professor of medical ethics. Dr. Mark Blecher as a director in the department in the National Treasury. And then we have three observers, Professor Abdul Karim, the chairman of the MAC on COVID-19, Bishop Lucy Mpuwana, who's the chairman of the multi-sectoral MAC on social behavior, and also we have an observer, Malua, from the WHO. So you can see it does contain a variety of expertise. And in addition, we have technical working groups where we do have people coming from outside the MAC, outside the Ministerial Advisory Committee, to look at various aspects of various tasks, various projects, to also assist in that. So the expertise that provides the scientific advice is a lot wider than what we have here, but of course it's steered by the Ministerial Advisory Committee, as I've mentioned here. In addition, as the Minister mentioned, to the MAC, there's also a task team which is tasked with coordinating the financing from the private sector and also procurement, logistics, administration. The Minister will introduce them at a later stage. But just to mention the names now, Mr. Adrian Gores, well known, Head of Discovery, Sandila Zungul, Liz Cochrane, myself, and from the Department of Health, Dr. Quina Tulara and Dr. Untitled Chapter. So why are vaccines important, and what role do they play in the control of this infectious disease? All infectious diseases, and of course, particularly in COVID. There are really kind of two phases of their involvement, of their control of infectious diseases. The first one is really a selective one, a personal one for personal protection to prevent morbidity and mortality in the individual. And then secondly, to prevent the spread of infection in the population to achieve what we call herd immunity. Now, it's a commonly used term, herd immunity, but just to give some of the background, herd immunity is really a threshold which is reached when a certain proportion of the population is immune to an infectious disease. And once that threshold is reached, the infection gets controlled and it declines. The infectious agent, in this case a virus, does not disappear. There's only one infectious agent which has been eradicated, in that smallpox, as a result of vaccination. But it does bring down the epidemic to a controllable level. And that's really the threshold that we're trying to reach with the vaccination. And the figure of 67% is a rough calculation of the threshold based on the reproductive number of the virus. In addition, of course, we do need to lower the possibility of this infectious agent circulating in the community. So those individuals who do get vaccinated, we aim to have them also not act to transmit the infection on an ongoing basis. So these are all basically the considerations which the MAC, our Ministerial Advisory Committee, looks at. I think I'll now hand over to Dr. Pillay to go into the more details of the rollout, the framework. Dr. Pillay.
Thank you, Prof. Shub. If I can be allowed to put up my slides, please.
Thank you. Professor Shub, if you can, thank you. Yes, and share, and then Dr. Pillay will be able to go ahead. Thank you.
Good evening to Minister, Deputy Minister DG, MAC members, as well as colleagues in the department, and to members of the media. Thank you for the opportunity, and this presentation covers a number of areas that the Minister had indicated, largely linked to the rollout of the vaccine program. So I think it's important to highlight that the vaccine program is intended to impact on the spread of COVID-19 across the country, and the COVID-19 vaccines that are in development are intended to address this. So I think we need to look at the vaccines that are available and understand how best we can procure and roll these out. Professor Shub has gone through these slides, so I'm going to skip straight through to the framework on the vaccine implementation. At the governance level, we have a number of structures that we've put in place, and I'll share some of that with you now about how this process will be governed. Secondly, we would have to have a very effective communication strategy so that the communities clearly understand the vaccine program and when they will be eligible to be vaccinated, and to engage with the program and respond when we call them up for vaccination. Working with stakeholders and taking guidance from them about communities and perceptions, etc. The training of staff as well in this process. We will be working very closely with the provincial colleagues and the district health teams, as well as the private health sector in this program. Our process will be largely to prioritize populations for the allocation of vaccine, to then distribute the vaccine, manage the administration, as well as the safety, as well as the effectiveness of the vaccine being monitored quite effectively. When we supply, we need to monitor and track the stock and the vaccine uptake use, as well as coverage. Vaccines must be monitored as well for any adverse events or perceived adverse events, and so we need an effective reporting system to do that. Clearly, regulatory considerations are critical for this as well, and I'll talk a bit about that, as well as the budget and financing around it. On the leadership and governance side of things, the vaccine rollout will be led nationally with provincial health departments, as well as our colleagues in the private health sector working with us on this. So there will be one procurement approach, and we will then work with our provincial colleagues and the private sector to distribute vaccine across the various sectors. So we'd have to have a national vaccine coordinating committee, and Dr. Bamford, who is very much involved with the vaccine program currently in the department with many years of experience, will chair the group and bring on board the various programs in the department that would contribute to make sure that this is an effective structure, such as the colleagues in the expanded program for immunization, communicable diseases, the medicine supply chain, the supply chain management as well, information systems, human resources for health, PHC, the monitoring and evaluation teams as well. We'd also bring colleagues from our provincial coordinating committees, which will be established, as well as the chair of the national private sector committee that's coordinating the rollout within the private sector. The World Health Organization will also participate. In addition to this, the provincial departments will establish similar structures with similar skills on board, and include as well colleagues from the private sector coordinating committee at that provincial level to make sure there's effective coordination. There will also be structures at a district level to monitor the rollout. Within the private sector, the committee needs to bring on board the funders of healthcare medical schemes, as well as the providers such as the private hospital groups, pharmacy groups, general practitioners and specialist associations, the nursing associations, allied health professionals, logistics providers, and as well as the employers, labor organizations and business associations. So to bring together the entire private sector so that we can effectively manage the rollout on the private sector side as well. The approach that we're going to be using in terms of the introduction of the vaccine is phased, largely because the supply of the vaccine as well as the capacity to immunize people will take time in each group, and we'd like to do this in phases. So the first phase will be our frontline healthcare workers. The target population that we have from our estimates, about 1.2 million. We would then go to phase 2, which is the essential workers, and here we have a number of categories within phase 2. The essential workers, the persons that are in congregate settings, persons that are over 60 years old, as well as those that are over 18 years but have comorbidities that are associated with the high morbidity and mortality for COVID. And then in the third phase, we would be identifying persons that are over 18 years that would potentially need to be vaccinated to get to the herd immunity target Professor Shub was talking about. So the phase 2 looks at essential workers. These include our police officers, miners, workers in the security industry, retail, food, funeral, teachers. This is not an exhaustive list. I think we would over time include the broader range of potential essential workers that would need to fall into this category. Secondly, the persons in the congregate settings, those that are in care homes, detention centers, etc., they would all be part of the second phase as well. So would anybody who's over 60 years of age. And then finally, those persons that are older than 18 years with comorbidities, particularly such as diabetes, chronic lung disease, which has been associated with higher levels of morbidity and mortality in terms of COVID. This graph is intended to give you a depiction of what the rollout will look like in terms of the number of limited doses. We have an understanding that in the first phase, we would have a limited supply of doses as many of the pharmaceutical companies ramp up their production. So in the first quarter, which is from January to March, we will have some doses, but the volume of doses is not going to be significant. This will increase quite a bit in the second part of the year as manufacturers ramp up their production in all of the areas, and so we will see massive increases in the coverage of the vaccine during this period. How will we be delivering the vaccine? Well, we're looking at three platforms as such. The first is a work-based vaccination program. I think this will work very well for our hospital-based staff, particularly private and public hospitals at district level, where we'll be able to go in and provide vaccination to our healthcare workers. The second is an outreach-based vaccination program, and here we'll be having mobile teams moving from facility to facility. We anticipate this will work well in our PHC community health centers as well as our private medical centers. And then finally, we would also be establishing vaccination centers, particularly in remote areas or where facility-based vaccination centers would be appropriate, such as community pharmacies. And here, your independent healthcare workers could potentially go to those settings. In phase 2 and 3, we would be using platforms such as the public facility vaccinations in the PHC facilities, as well as the vaccination centers I spoke about. These could be community pharmacies, as I said, GPs or NGOs or similar structures that could be set up quite easily. The outreach vaccination program would be these mobile vehicles that will go out. And finally, we would also have work-based vaccination programs, particularly in the mining sector and other industries that would anticipate that they would like to vaccinate all of their employees. They may have an occupational health service on the facility, and so there's a possibility for them to do that. In terms of selecting the vaccine, clearly the key issue is availability. Once we've passed the hurdle of a supplier having stock available, we need to ask the question, is this a safe vaccine? Is it effective and of good quality? And our regulator, SAHPRA, will answer that for us before we use a vaccine. Ease of use is important if we have choice. The second is storage and distribution. Vaccines that have to be stored at ultra cold temperatures are obviously a challenge for us. The supply and distribution, particularly the supplier capacity to produce the volumes as we roll out the program. And then finally, cost would be a factor as well. If we move to regulatory matters, just to make the point that I was making earlier, SAHPRA will certainly be looking at expedited regulatory review of the applications. They already have agreements with the EMEA, US FDA, MHRA, as well as the TGA on assessments of these reports, so that the review on our side doesn't need to take as long as it usually has to. In addition, SAHPRA will adopt a priority review approach for all vaccine applications. They've established a committee that's looking at that. There will be flexibility clearly around labeling and packaging, so that we can roll out these vaccines in a minimum period of time. Clearly, if we don't get a registration from a company, we may be able to use Section 21 as an interim measure, and we're thinking about that for a number of products. We have meetings with a number of manufacturers, and I'll talk more about that, and we've clearly encouraged all of them to submit their dossiers to SAHPRA. None of them have done so completely yet. They've shared some data, but not all of the data has been submitted, but we continue to encourage them to do so. On the procurement side, we would be governed by the Public Finance Management Act as well as the Medicines Act. So in this context, we would be having to use some of the emergency procurement procedures where that's appropriate for vaccine, etc., and not have long procurement timelines so that we can get a vaccine available as soon as possible. We will approach the National Treasury for those types of deviations so that Treasury understands this approach. Clearly, SAHPRA registration or some approval from SAHPRA will be required before we can procure. Vaccine security is also an important issue. We have learned from the distribution in other countries that the safety and the theft of vaccines is a problem. So we will certainly be tracking the vaccines and the vehicles, moving them through. There'll be track and trace of vaccines using barcode scanning, as well as the safe and secure disposal of these packaging, as well as vials, and data verification linked to the volumes that have been submitted in terms of volumes that are vaccinated as well. Very important in this process is we need a lot of information, so data management and surveillance is critical. In terms of this, we will need data that monitors the uptake and coverage as well as prioritization of the groups, planning, safety monitoring, as well as the vaccine effectiveness. We would be establishing an electronic vaccine data system. This system will be leveraging off our current electronic systems, which will provide us with information about the patient demographics, the number of doses the patient took, the health establishment where that happened, the safety information and any adverse events that occurred, so that we're able to track back if we get signals of such problems, a record of the vaccination issued as well. In terms of our negotiations with the pharmaceutical manufacturers now, if I can move to that area, just to say, firstly, we met with a number of manufacturers. Firstly, there were a number of producers from both China and India that were in the development phases, and they've shared many of the studies with us and with the Ministerial Advisory Committee. So the department and the MAC have met with a number of suppliers, and we started meeting with them last year quite early. Some of the suppliers are Pfizer, Astrozeneca, Johnson & Johnson, Moderna, as well as Cipla. So many of these suppliers suppliers required us to sign off non-disclosure agreements. These agreements basically require that we don't share any information until the point at which the vaccine offer is accepted by ourselves. And so for that reason, we are limited in terms of some of the information we can share. The vaccines that we've been looking at, and just to give you an overview, the Pfizer vaccine, as you know, has been approved by the FDA on an emergency basis, and a number of other countries that have got into bilateral deals have also done so. The World Health Organization pre-qualification has also done approvals. SAPRA is still waiting for the final application to come through. We anticipate that will happen during the month of January. The effectiveness of this vaccine is 95%. It's a 2-dose vaccine. The rollout has happened in a number of countries, particularly those that have had bilateral deals. This hasn't happened through the COVAX facility because COVAX has not got into agreement with Pfizer. The storage of this vaccine is -70, which has created a limitation for us. We have very limited commercial, ultra-low cold chain storage for such vaccines. And so we would need to be cautious about the volumes that we would be able to procure if we use such a vaccine. The second is the Astrozeneca vaccine. This vaccine is approved by the MHRA, which is the British authority, as well as the DCGI in India. And we anticipate more authorities will probably be approving this vaccine fairly soon. It's also a 2-dose vaccine, 70% efficacy. The AstraZeneca has basically outsourced its production to a number of sites globally with the target of producing billions of doses of vaccine. The largest vaccine producer globally is the Serum Institute of India, and this company doesn't have a presence in South Africa. However, its local partner is Cipla, and the Serum Institute will probably be one of the biggest producers of the Astra vaccine. This vaccine is likely to become the most widely used one globally, simply because it can be stored at fridge temperature, and the volumes will be quite high in terms of production. I think over the next few months we'll see this. And the company has taken a very a responsible approach of tiered pricing, and so you'll see different prices based on countries' affordability. Then the Johnson & Johnson vaccine, here this product has not been approved yet by any of the regulators. The company is still putting the dossier together. Here again, we're expecting this in January. Once this vaccine is approved, it'll be a real advantage because it's a single-dose vaccine, which is quite easy to administer, not having to call a person back for a second dose. It'll also be quite cost-effective for us in terms of the delivery of a single-dose vaccine. This company has also got into an agreement with their local manufacturer, Aspen, on a contract basis. So Aspen will be producing some of the volumes of this vaccine. The last one is the Moderna vaccine. This is a vaccine that has been approved by the FDA. It's a 2-dose vaccine. It's stored at -20, not fridge temperature, but not as cold as the Pfizer vaccine. This company doesn't have a presence in South Africa. We reached out to them eventually through Lex Cochran, who's on the advisory task team on acquisition, and we tried to persuade them around supply. It's clear they have no intention of filing a dossier anytime soon with SAPRA at this stage. The vaccine procurement, just to give you a sense about what's going on there, the COVAX facility has focused predominantly on agreements with vaccine suppliers that are suitable for developing countries. So they've stayed away from the ultra-cold storage simply because it'll be very difficult for developing nations to accommodate such a vaccine. Now, Pfizer was the first vaccine out of the blocks and has become available. A number of developed countries, you will see, has rolled out the vaccine. And these are countries that have got into bilateral agreements. They're not part of the COVAX agreement as such. So we see a lot of that rollout taking place currently. COVAX is focused mainly on the vaccines that can be kept at fridge temperature, our usual cold storage can accommodate. the vaccine from AstraZeneca and Johnson & Johnson is likely to be part of the COVAX supply. AstraZeneca has just been approved in the UK and India, as I indicated, and this will allow for the mass production of this vaccine, and they anticipate to have 2 billion doses available by the end of this year. In terms of vaccine procurement for ourselves, we're clearly working to secure a sufficient supply of vaccines within the shortest possible time so that we can protect the most vulnerable in our community. This is the most critical part of our work and trying to get these deals secured. We're part of the COVAX facility, as I indicated and Minister has advised. And as part of this COVAX facility, they've indicated to us that we should expect vaccines in the second quarter of 2021. We have been in contact with them last week, and they have indicated that they're working very hard to bring that date forward to the first quarter. But at this stage, we've received no firm commitment around that. We've also been in bilateral discussion, which I just described, with all of those companies. With a number of these companies, they've indicated to us that they may be able to supply, and we need to firm up some of those agreements. Until we firm up the agreements, as I indicated, the non-disclosure agreements at this stage prevent us from providing much of that detail. But we're fairly confident we would have vaccine in quarter one. As soon as we do, and we have a contract in place, I think we will certainly be sharing that information. Thank you, Minister. I will stop at that point.
Thank you very much to Professor Shub and to Dr. Anban Pillay. The team that, the Vaccines Acquisition Task Team that I said I was going to introduce, of course, has been introduced, but let me just say for completeness sake that it's chaired by Adrian Gore, and I'm sure many of us are familiar with him. He's leading in the medical aid industry. Then Mr. Sandile Zungu, who is also well known in business, working as part of the leadership of the Black Business Council. Then Mr. Lex Cochrane, who's also in the private sector. And then Professor Berishub, who has just presented to us. And then the other members would be Dr. Aquina Tulare and Dr. Anban Pillay and Ms. Sibusisiwe Ngubane Zulu. So that team is doing the work in relation to facilitation of the partnership in resource mobilization between the public and private sector. What we will do is probably in the next couple of days, we will actually bring that team on board. Also, some of the members are present here. I'm not sure if they will be visible, but some of them aren't here. I know that Mr. Adrian Gore has tendered an apology because of something that's called him held up. I know that some of the other members were going to attend. So I think you might come across their activities as we go into the community, and therefore that was the main issue of raising their presence. When the president was talking about the partnership with the private sector, they are the team that's been assigned by the ministry to do the facilitation work at that level. We will obviously have time to just engage in that kind of discussion so that we can just understand what has been done and so on. But as I've indicated earlier, some of the work that related to engagement of the Council for Medical Schemes and all the other medical aid structures that have been involved, it comes from this, and some of the business leaders that have already been involved, it comes from here. Thank you very much. Let me request that we can pick up some of the questions. I think if we can hand over back to you, Dr. Manzi.
Thank you very much, Minister. Minister, we have a large number of questions on the webinar itself. I don't think we'll be able to get through those questions. Now, fortunately, there are lots of common themes, and I would very much like to focus on the questions that have been posed to us by the media through the media groups. With Minister's permission, I'd like to begin with those questions. And I think we probably will only have time to manage those questions. There are already over 20 questions just on my side alone. And perhaps with Minister's permission, some of the questions that have been asked on the Q&A section may be responded to in writing by members of the panel. If that is in order with Minister, can we proceed in that manner?
Thank you. Let's proceed. We'll be following your guidance.
Thank you, Minister. So we will begin then with, I will do about 12 questions, and I think that we're going to be inviting members of the panel, especially those who have presented, to answer some of these questions. We'll begin with Christelle de Toy from The Citizen. Will South Africa be buying the Pfizer-BioNTech vaccine? And secondly, will citizens be able to import vaccines approved by the WHO should they have the means to? I then have Basetsana Pora from GUM Gun TV. Is the department ready for any downsides that could be similar to those we have seen in reports from countries that have started giving out jabs, for example, adverse effects or reactions to the vaccine? And has natural immunity in South Africa ever been real, seeing that Minister says a vaccine is the only way to beat the pandemic? From John Bailey at ENCA. Is the government in parallel discussions with pharmaceutical manufacturers to secure the COVID-19 vaccine? If so, whom are they talking to? Which vaccine is suited for SA? What is the government's rollout plan for the vaccine? I think a lot of those issues have been covered, but if anybody would like to just kind of come in there, that's fine. Vickers Berger has asked, can the minister please comment on the open letter undersigned by various scientists, including Professor Glenda Gray, regarding the vaccinations? Amongst other things, the government is accused of not acquiring vaccinations soon enough. According to the scientists, this will lead to thousands of more deaths and irrevocable damage to the economy. And that's because Berger from Netvac 24. He goes on to ask, with regards to the purchase of vaccines, how much money will be contributed by medical schemes? Will vaccinations purchased with this money be available only to medical scheme members or state patients as well? He also goes on to ask, can medical schemes import or buy vaccines themselves or not? And why are they not using their reserves to fund vaccines for their members? Carol Payton from Business Day. Dr. Pillay said there will be one procurement approach. What does that mean? That every vaccine dose procured will be done centrally managed by government? And how will the public-private partnership work? Is it envisaged that A, funds raised from the private sector will cross-subsidize public procurement, B, that medical schemes will cross-subsidize vaccines provided through the public sectors? And how much will it cost to vaccinate 67% of the population? Mariam Issa from Finweek. Have you been negotiating with Chinese companies Sinopharm and Sinovac, which have produced vaccines already approved and ordered by many developing countries? Vickers Berger has added some further questions. He asks, please name the company or companies in Russia the government are negotiating with. And also, please provide the names of the relevant company or companies in Russia. And then the last question in this batch, Minister, is Bevlin Makoe from Eldos FM. How will the government secure enough vaccine for everyone in need when they're struggling with supply of testing kits in Eldorado Park? And how will they bulletproof this process from corruption? Minister, she has not given us details on the issue she's raising of the testing kits in Eldorado Park. Thank you very much, Minister. We'll stop there for now.
Thank you very much. I will not respond to all the questions. I'll leave the team to deal with them. Just one question on the financing. The spirit of this public-private partnership is on the basis of social solidarity, cross-subsidization. In other words, the funds that will come from the private sector and the medical schemes will actually assist to cross-subsidize some of the public that will receive the vaccines. So we will be able to sit together, and once we have a decision taken as to which vaccine we have agreed on, then we'll be able to know the exact amounts that are involved. But largely, if you look at the medical schemes, they are covering about 9 million people. And so if they cross-subsidize a similar number of people, that could be one way of looking at it. And then the private sector, because we are still having ongoing negotiations, the principle is more or less the same. And then, of course, we'll have to put all of that together. And we have targeted 67% as the minimum, because of what scientifically would take to create a herd immunity where there's protection of everybody across the country on the basis of that. Of course, as I've said, it would be good to get everyone to have the vaccine, but I think the issue that we're raising here is what is the current plan that we're dealing with. So I'd like to request that the team talks to the rest of the various other questions that have been raised. The question of whether we're purchasing from Pfizer or not, we're in negotiations. We can go as far as that. Once we know, as a matter of fact, the key issue for me as minister is who has vaccines available. So you might find that someone has got vaccines, they are prepared to sell us, but they will only be available at the end of 2021, and therefore doesn't make it available immediately. So those are the technical issues that we have to work on as we do the negotiations. So if there are issues that are not quite clear at this point, it will be really because we have to refine certain issues in negotiations which are ongoing, and we can give regular updates on these issues, but it's not always possible to give you all the details of issues that are not really finalized. Then the question, therefore, of the cost is a bit difficult to say, because the cost of the vaccines are varied. And the fact that each one of those is not concretized as to who will be able to settle on an agreement with us makes it difficult for us to give you a figure, because those figures are going to be based on who is which vaccine and what is the cost, and then we can then work out the figures from there. Can I request that the team can come in there as well? As we have said, in terms of medical aids, we have not really said how much has to be put in there, but once we've got all the figures concretized with the agreements, then it will be easy to give all of those details at that point. Thank you. We can ask Professor Shub and Dr. Anban Pillay. There's also Director General if they would like to respond to some of these issues. Thank you.
Yes. Thanks very much, Minister. I think the financial and procurement questions, I think, would best be answered by Dr. Pillay, but maybe I could just comment. There was one question regarding side effects of the vaccines, and they've been very rigorously looked at by an independent data safety monitoring board during the trial stage, and of course, again, when the respective vaccines apply for licensing. And they have an exceptionally good safety profile. The the side effects which have been reported have been first of all uncommon, and second of all mild. Usually a tender arm for a day or two, and maybe a very low-grade temperature. There is one side effect which has caused a little bit of concern, and it relates to the Pfizer vaccine, and that there has been reports of quite severe allergic reactions, what you call anaphylaxis. It's rare, but it seems to be a lot more common than with other vaccines, in fact, up to 10 times more common. So this is being looked at, it's been examined, and also there is a precaution that people that do have an allergic propensity should get the vaccine under medical supervision. But other than that, so far the vaccines have been all of them have been very safe. And then the issue about natural infection, this is something that is not totally clear at the moment. The most latest literature, scientific literature, seems to point to a persistence of infection, of immunity after infection, which may last for quite a few months. the cells which produce antibodies, we call the memory B cells, do seem to persist for at least 6 months in many patients. Earlier literature seemed to indicate that maybe individuals who get the non-severe infection, the mild infection, or asymptomatic, no symptoms, do tend to have a lesser antibody response, and sometimes those antibodies disappear quite quickly after infection. So it's a little bit, at the moment, a little bit murky, but it does appear to be reasonably promising that certainly the vaccine will give immunity for at least quite a number of months after inoculation. But of course, this is ongoing. It's early days at this stage. I'll hand over to Dr. Pillay, I think, for the other questions.
Thanks, Prof. Thanks for that. Thank you, Minister. On the question relating to importing of vaccines, I'll probably answer that together with the question around the procurement approach. So we're taking a single procurement approach. So as a country, we will buy a stock for the entire country, and then that will be distributed across the various sectors as Minister had described. The idea of an individual importing a vaccine, I don't think that will be possible. With all of the pharmaceutical companies that we've been speaking to, one of the key things they've indicated is they're only dealing with governments, given the scale of the vaccines that they are supplying, as well as the logistics involved across the globe. They're not wanting to deal with smaller orders as such. So I don't think that would be possible. On the adverse drug reactions, as I mentioned in the talk, we have a reporting system that we put in place so that we can detect adverse drug reactions and signals early, so that we would be able to intervene in terms of that as soon as we find such signals. I think the question around the Chinese vaccine, the manufacturers of the vaccine had shared with us the phase 1 and phase 2 trial information at the time. They have not come back with the phase 3 data, because they would need to do that with SAPRA so that we can consider whether the vaccine could be used in South Africa. Similarly, in the case of Russia, we had a similar experience with them around that. I think those were the key questions, Minister. Thank you.
Yes, thank you. If I can just come in as well to indicate that a number of these, some of these companies, for example, from China and in Russia, there's been partnership with some South African companies. So those companies have reached out to us, and we work with them. I know that the Ministerial Advisory Committee has had several meetings with the Russian group, and we've also personally met some who are dealing with the groups from China, and so we are waiting to see progress in that regard. Then there was another point which was raised, another question about the open letter. Yes, we have noted that there have been concerns from some professionals and some of the researchers and scientists and so on. I think broadly, there are issues that we will all be concerned about. The first issue would be that if you see the second wave as it's coming now, and you don't have much information about what is happening, or you're not part of the team that is working on it, you might really feel very anxious. But also just the fact that the second, the surge that we are going through is having its impact, it does create a lot of anxiety on the one side. On the other side, in the letter that I noticed, they made a comment that they were not aware of some of the information. And therefore, part of what I think might be a challenge is that if they may not have been having access to some of the information, there would obviously be a basis for concern. And out of that concern, I think this kind of meeting, this kind of briefing will assist to allay those kinds of concerns. I think for the general public as well, it's important for us to say that we are managing the situation with the acute awareness of the anxiety, the tension, the urgency that surrounds this matter. And so everything will be done by government to expedite the availability of the vaccines. And this is being done really out of the fact that it's only in the last probably 2 months or so there where you have had concrete positive reports that would have come out to indicate the levels of efficacies. And then, of course, there are some vaccines which we still want to look at, which are going to be releasing some of their results in a couple of weeks' time. So at the end of the day, the idea is that the more affordable the vaccine would be, the better for us, because it will mean that we'll be able to reach to many more people in the country than would have been if we had gone for the expensive or less affordable vaccine. Nevertheless, if that vaccine is the only one that's available, of course, there's merit in saying let's then go for it. So I would say that we have moved with caution, but we have taken into account the urgency of the matters that are at hand. We could take the next question of questions. Thank you very much.
Thank you very much, Minister. The next batch of questions, we have, right, okay. I will give an opportunity to everybody to ask their questions, but the panelists are very welcome to skip over those questions that are repetition. So we have also Brits asking with which specific pharmaceutical companies and or developers is SA negotiating to get us vaccines. I do believe we covered there. Sophie Mukwena from SABC has asked if we're going to engage Johnson & Johnson and AstraZeneca outside the COVAX facility. I think we are covered there. LCB Brits from Freya Beekblad has asked if Johnson & Johnson is going to make vaccines in South Africa, will we be the ones to have the first option to buy? And why are we so slow, only late 2021, if other developing countries are already vaccinating? And what are the logistics to rolling out? I do believe that Dr. Anbad Pillay has indeed elaborated on those logistics. From Christian Duplessis, he once again asks about the open letter from Glenda Gray, but he has put it differently. He says, who is responsible for what Glenda Gray and other experts called a monumental failure in inverted commas of South Africa, not having closed bilateral deals with suppliers early? Please account to the South African public why government failed to secure these deals, and what percentage of the population needs to be immunized for herd immunity to be effective, and by when will this happen? LCB Brits again, is it true that AstraZeneca has no vaccines for South Africa and they referred us to the Serum Institute of India, and if so, why? Angelo Coppola from CGTN, what will the vaccines cost via the COVAX facility? I do believe that's the question. And at what price per vaccine will government negotiators stop bilateral negotiations with pharmaceutical companies or manufacturers? Michael Marillier at ENCA and ETV, will the state treat teachers as essential workers when distributing the vaccine? And will they get some sort of priority as frontline workers? Okay, Sophie Mukwena from SABC once again asks, South Africa and India have made an appeal to the World Trade Organization that the COVID-19 vaccine patent restrictions be removed and that the vaccine be declared a public good. Are we winning in this battle? Nelson Somi from Health 24, are non-medical workers such as security guards and cleaners, etc., in healthcare facilities included in phase 1 or 2 of the vaccination process? Mark Haywood has asked us, why are non-disclosure agreements necessary for a public good? Whose interests do they serve? So that's Mark Haywood at Maverick and the Citizen. Bruce Hong at Cape Talk, it has been reported that in the UK, there have not been measures put in place to ensure that recipients of the vaccine get the follow-up injection of the same vaccine. Is there such a risk here, or are we only going to get the one single brand, single dose, I assume he's asking, or will there be a system in place to ensure that there are adequate supplies to allow for the follow-up vaccination and that it is the same one? Mark Haywood, the final question, Minister Mark Haywood again. Is the private sector procuring vaccines independently of the government process or medical scheme members? And again, I think we are covered there. Thank you, Minister. I think we will wrap these batch of questions, and then I think we will need to give the Minister and the Deputy Minister a chance after this just to address our people in vernacular. Thank you, Minister.
Thank you very much for the questions. Firstly, let's deal with the question of a monumental failure. I think it's somebody's view that we don't agree with it. We think that everything that has been done with a level of consciousness on the agency and the need for us as South Africa to be able to ensure that we can get vaccination as soon as that is possible. We may argue in various ways on this matter, but the reality of the matter is that maybe today the argument would be about how government was so negligent to waste money on unproven, vaccines. The risk was high that we wouldn't know which vaccines would be accessible, also would be successful. And on that basis, we have were within the time frames within which we could still be able to catch up with the rest of the immunization. Many countries will start at different times, but for most of next year, the general approach would be that that's the time we must reach as much of our population as possible. So we don't accept that the situation we're in represents failure. What we do understand is that the matter is a lot more intricate than what people might consider. The various countries, for example, the various companies, for example, whilst the issue of the vaccine could be seen as a matter of public good, but at the end of the day, we still have to go and negotiate and purchase those. It's not all based on donation. So at the end of it, certain commercial principles have to be fought through in terms of how much, what volumes and what prices and all of that. And there is also no hiding the fact that some of the countries with bigger resources and higher and larger populations would have been seen more favorably in any case. That is the reason why President Ramaphosa said we need to also ensure that we approach the procurement of vaccines. These negotiations must be approached from a continental perspective, because once you do that, you start negotiating on behalf of 780 million vaccines that must be made available to the continent. There is, of course, an issue here which we have to fight as South Africa, as the African continent, but also as low-income countries, and that is, there is no justification for the well-resourced countries to hoard the stock. Some of the countries have ordered stock that is more than 5 times the population size. Some of the countries have actually opened to us the numbers of vaccine that they've bought, and they've actually even indicated they've got options of buying additional stuff. And we have actually argued that it's unpardonable. They have to consider releasing that stock. So there's a lot of fighting that we're doing behind the scenes. It's just that it's not necessarily for us to be disclosing all of that. The other question, somebody asked the question about Johnson & Johnson, whether we'll be the first ones to buy. We are having a huge debate at that level. I don't want to go into details, but the real issue is that most of the companies, whatever they are producing now, is based on the orders that they've already procured. But when we went to some of the, zones that we spoke to a number of countries there, we found that they'd actually put up orders in about almost 9 or 8 or 9 of the of the vaccines, and they put the orders at that kind of level. Obviously, they will not use all of that. So the question also is for us to have the skill to be able to argue that some of the stock has to be released. And so we have to also approach the companies to say there is a moral responsibility to make available some of the vaccine, because we're not asking for charity, we're buying the thing, we're gonna pay for it, like what others are doing. So there's a lot of fighting that we're doing behind the scenes to deal with this issue. And so as far as I would be concerned, we have done as much as can be done. We still believe there's a lot that has to be done. And in some instances, we have to actually rely on the weight of the president to call certain particular companies to say, let's sit down and negotiate and discuss the issues. I would just like to say that on that basis, we just plead that to give us time. Let's work on this issue, because we have been working on it, and as far as we're concerned, we are going to get where we're going. And for South Africa, our primary responsibility is to ensure that our country is protected, and it will be protected. The issue as to when exactly we get these vaccines is a matter that we're fighting every day, and at a certain point, we'll be able to look back and say we have been able to, we've achieved it. The issues that relate to the NTAs on a matter of a public good, well, there are lots of issues here. There are issues of competition of the various manufacturers. There's also the question of people's, protecting their own, specific issues that relate to what they are doing and what they have done and so on. We have to respect that on the basis that if you do any normal procurement or business transaction, you have to understand that there are sensitivities that you have to deal with. But those sensitivities don't actually mean that we will be hoodwinked. We will argue and engage and motivate our own case and get the best that we can get out of that situation. But I think we all know that the various companies, whatever they have not published, we can't be the ones who must disclose some of those issues. So it's a usual thing that gets done, this kind of non-disclosure issue. Then the question of teachers, certainly the teachers will be amongst those that are frontline workers. The list was given by Dr. Anban Pillay. It's not necessarily exhaustive, but it's just to indicate that those who are in the front line of service have to be given police, and some of those who are in the particular service points have to be looked at from that point of view. The issue of the risk to follow up is a real issue. That's the point that we've been discussing, because what it will require that we must have a central database. That database must be able to record whether the individual, was given the vaccine in a hospital or by a private practitioner or whatever. It needs to be properly recorded so that we don't duplicate, but we also don't lose someone in case we need to make sure we've got a reference point. We also need to be able to find a way of ensuring that there's a clear indication that someone has had the vaccine, because you be aware at this point that there are some countries that are already calling for people who can come into who can travel to those countries must have proof of vaccination. It may well be a problem that will affect a lot of us if we actually delay with the issue of vaccination. So we are aware that that pressure is also going to build up on us. So we want to make sure that that recording system is also quite clear and it's able to help us through. So we can't give you exactly what price we'll negotiate. We're going to fight through. Some of the prices that have been published, we are fighting, but we have also been arguing to say we're trying to get as well that we shouldn't be made to pay a price which is much higher than what others have paid before. And all of those are issues that we have to engage ourselves on. If I can maybe hold it at that and ask if my other panelists might wish to make comments on this matter, and then we can round it up from there. Thank you. Professor Schupp, if you'd like to come in.
Thanks very much, Minister. I think we've covered most of the things. I think maybe there were just two medical questions I can just talk to. The one relates to how one calculates what is herd immunity. Well, that depends on the infectivity of the virus. It's what's called the reproductive number, or R number. And the R number means the number of susceptible people that are infected by a person that's infectious. So in other words, an R number of 2 would mean that an infectious person will affect 2 susceptible individuals, everything else being equal. And there's a formula, it's called 1 minus 1 over R, which determines the herd immunity. And it's generally calculated that the R value is 2.5, which will give you more or less a herd immunity threshold of 67%. And that's where we get that figure of 67% from. In other words, that would be the threshold that once we reach that level of immunity in the population, the infection will be controlled and will come down. And then there was another question related to if it's 2 doses, can one have different vaccines? No, the 2 doses must be the same vaccine. Otherwise, there could be interactions between the 2, and the second one might be inactivated or may it won't work by the first one. So the 2 doses should be the same vaccine. They often use different, what you call platforms, different ways in which the vaccine is made, and that's why they should be the same. I'll hand over to Dr. Pillay for some of the others.
Thanks, Prof. Thanks, Minister. Yeah, I'll just handle maybe 2 of the issues. The first is, I think it's important to emphasize the point that when we in negotiations with these companies, there was a very clear term sheet that we were given. Pay a deposit as well as be committed for the entire amount at the point at which the vaccine is ready for delivery to South Africa. So there's a clear financial commitment before in the form of a deposit, and you are liable for the balance as soon as the product is produced before they even ship it to the country. And these were the term sheets. Unfortunately, under the NDA, we're not allowed to release those, but that's the reality that we faced. And all companies have had the same rules. I guess the one followed the other. And so that's been the way the market has been operating, because it's now a commodity that's rare. Also wanted to make the point that I know there was a comment that suggested that many developing countries and developed countries have started vaccination programs, but it's important to appreciate that most of them have basically launched their programs using either the Pfizer vaccine, the Sputnik vaccine, or the Sinopharm vaccine. Now, the Pfizer vaccine, as you know, is a difficult vaccine for us. We can only use limited quantities given our storage capacity. And the Sinopharm as well as the Sputnik vaccine, these two, the companies have not come to SAPRA as yet to register the product, because clearly there are certain requirements for regulation in terms of efficacy and safety and quality, and so that hasn't happened. So we were not able to access those products. So clearly, if you look at these products, they're only the 3 that these countries have been using, and we need to understand that the other quality vaccines that are coming through will be available fairly soon, and we'll be able to use those. Thank you.
May I just add as well the point that Dr. Anban Pillay is raising. I've seen in the media some were arguing that we could have put some advanced market commitment that is refundable, so we could have put money and kind of commit certain vaccine manufacturers to deliver to South Africa. That option was not there when we were involved in the discussions. The only safe mechanism that we were able to get was the COVAX, wherein, because of the numbers and the fact that you were betting on 9 vaccines, therefore there would have been a chance of success was much higher. That was the option that we considered was the best for South Africa. But the others, the arrangement was, as Dr. Anban Pillay was saying, that if you put in money there, you were liable to lose if it didn't succeed. But also because we didn't know the ultimate cost of the vaccines, we couldn't really be in a position where we were able to commit the country on an unquantifiable future debt that's related to that particular vaccine being produced. But also we would have had a challenge when we needed to decide to change which way to go, because we would have actually stretched ourselves over so many, and that the commitment was irretrievable. So those were the issues that we had to face at that point. But some of the people who have commented have not been part of the negotiations or the discussions. We have been through this, so we were aware of some of those issues. I think some of the people would have assumed that such a thing was possible, but I think when we sit with them, we can actually show them that they probably are mistaken. That's not how the situation had evolved over the period. And of course, as we deal with this issue, we deal directly with the companies. We don't deal via any people in between. We're dealing with directly with the companies that do the manufacturing. So we will continue the engagement, and we really hope to deliver as quickly as possible, the protection for the country. And therefore, from that point of view, we would want to report on a regular basis, seeing that this matter, has got quite a lot of public interest. We want to make sure that there are regular briefings specifically on this one, just to make sure that when there are issues to be dealt with, we should be able to move on. It's been brought to my attention that there are quite a number of other questions that have not been responded to. So we're going to make an effort with the team to follow those questions, and if those who had asked the questions might have details, we'll be able to send them the responses. I think our contact person has to be Dr. Lwazi Manzi. Let me hand back to you, Dr. Manzi.
Thank you very much, Minister. I'm going to invite Minister and Deputy Minister just to talk to our people in vernacular for a few minutes, just to update them as well on the developments of the vaccine strategy, and then we will close thereafter with Minister's permission. Thank you.
Dr. Patla will start if it's possible.
Well, thank you very much, Dr. Manzi. I cannot put the camera. I think it's disabled. Thank you very much. I'll just carry on without the camera, because it's not enabled by the host. I think the only thing which one wants to
my apologies, we have a technical problem. Can we request that Minister go ahead, and then we will get DM back? Thank you.
You're on mute, Minister.
My apologies. I've just been asked to do a brief summary in vernacular, which the Deputy Minister is also going to do the same as soon as the technical issues are resolved. Sifisa-ke ukwazisa umphakathi ukuthi uhlelo lwanamuhla bekuzochaza ngesimo sokusenqubekela phambili odabeni lokusebenza ukutholakala kokugomela isifo se-COVID. Lokhu siyazi ukuthi bekuvele kuyinto esasishilo ukuthi iyona ndlela esozivikela ngayo kulesi sifo, ngoba noma selapha kodwa sibhebhetheka ngamandla kakhulu, ngakho sidinga ukuthi wonke umuntu azagcine ethole ukugonywa ukuze lesifo singamngeni. Ngaleyo ndlela ke besikusebenza kakhulu ke lolu daba. Inkinga yalomgomo ukuthi inkampani beziningi kakhulu bezizama ukwakha umgomo okuwona ozophumelela. Kodwa ngobuningi bazo ugcine kungacacile kuthina ukuthi imuphi ozogcina uphumelela. Kamuva ke sekuze kwabonakala ukuthi eminye
Now, huge apologies to our viewers for interrupting that address by the Minister. He was giving those who obviously didn't have the benefit of hearing it in English and vernacular languages, specifically isiZulu, explaining the vaccine rollout strategy. And of course, we will recap on that in just a moment when we return after the break.
Bethi uparalyzed kusho ukuthi impilo yakho isizoshintsha. Emveni kokuba sengilimele ngichitha isikhathi esikhulu ngisekhaya ngilalela ukhozi ngilalela abantu bafana no Black Coffee bakwazile ukuqhubeka nempilo.
Igama le project yethu Phaphama Community Project. Siye sikuthathele ipilisi. Senze sure uba